Hi, my name is April Perry, and I will be teaching inspection of the abdomen. The objectives are discussing the appearance of the abdomen and what's normal and what's abnormal, the quadrants of the abdomen and what body organ lies in each cavity, how to properly examine the abdomen, define and discuss the symmetry of the abdomen, define ascites and important manifestations, obtaining a health history, important client teaching and health promotion. At this time, I would like to introduce my client. Okay. My client is my spouse, Dietrich Perry, and a written consent has been obtained. Inspection of the abdomen. Inspection of the abdomen includes a large oval cavity extending from the diaphragm down to the brim of the pelvis. The abdominal wall is divided into 4 quadrants. At this time, we will have Dietrich to remove his top shirt. Okay, stand up, Dietrich. All right, at this time, we will discuss the cavities. It's divided into 4 quadrants, and in the right upper quadrant, we have the liver, gallbladder, colon, pancreas, right kidney, and adrenal. The left upper quadrant is the stomach, the spleen, left kidney, colon, and the pancreas. In the right lower quadrant, we have the appendix, colon, small intestines, and in your left lower quadrant, we have the colon, small intestines, and the ureter. When you're inspecting the abdomen, it should appear smooth and even. Common pigment changes is usually striae, and it's silvery white, linear or jagged marks that occur from pregnancy or excessive weight gain. Pigmented nevi or moles. They are circumcised brown macular or papular. Normally there are no lesions other than healed surgical scars. And this is very important. You always want to ask your patient if they have any healed or unhealed surgical scars due to possible underlying excess fibrous tissue. You also want to note the appearance of the abdomen. You want to note if it's flat, if it's distended, or if it's enlarged. When you're assessing the contour of the abdomen, the first thing you want to do is ask your patient to empty their bladder and explain what you are doing to the patient. Mr. Dietrich, I will be assessing your abdomen and explain exactly what you're going to do first, step by step. Wash your hands and you will put on gloves. And the patient needs to lie on a flat surface. You can go ahead and lie down. And it's very important to keep the room warm with adequate lighting. And if the patient is completely undressed, you want to take a spare bed sheet and drape it over the lower part of the body. This will allow you to fully expose the abdomen and the patient still has some privacy. When you are assessing the contour of the abdomen, the patient is supine on their back. The examiner is at the right side of the patient, and you want to stoop and you want to gaze the abdomen with the examiner head slightly higher than the patient abdomen. You want to determine the profile of the rib margin of their pubic bone, the contour, which you can see pretty good here. The contour describes the nutritional state, and it normally ranges from flat to rounded. And when you're assessing the symmetry, you want to shine the light across the abdomen toward the examiner, or lengthwise across the person. The abdomen should be symmetrically bilateral. Note any localized bulging or any visible mass. Examiner can highlight further change by asking the client to take a deep breath and assess the abdomen to see if it's smooth or symmetric. Now the umbilicus. The umbilicus should be midline and inverted. No signs of discoloration or inflammation or a hernia. And there should be no redness or no crusted area around the umbilicus. And you want to also note any movement on the patient's abdomen. Peristaltic, respirations, aortic pulsations. As nurses, it is important to obtain a thorough history of the client. Some important questions to ask, and you may sit up, Deidre. As nurses, it's important for us to obtain a thorough assessment of the client, and some important questions to ask is there any change in your appetite, or is there a loss of appetite? Any weight patterns? Have you gained any weight recently or lost any weight? Any difficulty swallowing? And when do you notice it? Food intolerance. Is there a certain food that you eat that you notice symptoms? And when do you notice it? Is it morning or is it night? Abdominal pain. Where is the pain? Describe it. How did it start? Is it constant? Nausea and vomiting. How often do you vomit? How much? What color and what odor? Is it bloody? Tolerating any foods while you're nauseated? And what helps it? Bowel habits. You want to ask the client how often they have a bowel movement. Describe it. You have any constipation or diarrhea? Past abdominal history, such as ulcers, hernias, including x-rays, or appendicitis. These are all important when you're assessing the abdomen. Medications. Some medications, such as herbal remedies, causes hepatitis. Nutritional assessment. Much information can be gathered by just simply looking at the patient and watching the patient. Health promotion. Obesity is one of the biggest concerns, and it is increased in the United States globally. So some health promotion concerns that we need to discuss with our patients is make healthy food choices, drink plenty of water, avoid alcohol consumption or smoking, always discuss your medications with your healthcare provider, even if it is over the counter. Notify your doctor if you're having nausea or vomiting or difficulty swallowing. Inform your doctor on past surgical history of the abdomen. One important condition of the abdomen that I would like to discuss is ascites. It refers to the abdominal accumulation of fluid in the abdominal area. It is caused by increase in portal blood pressure and decrease in albumin. The most common cause of ascites is cirrhosis of the liver. Diseases associated with ascites are severe liver damage, long-term hepatitis B virus, hepatitis C virus, or alcohol abuse, and certain cancers are also linked with it. Symptoms of cirrhosis. No symptoms for a small amount of fluid in the belly. As more fluid collects, the patient will have more symptoms, such as abdominal pain, bloating, and increased shortness of breath. The treatment for cirrhosis include avoiding alcohol, decrease in salt intake, fluid restriction, and diuretics. Possible antibiotics for infection. The procedure that we have with ascites is paracentesis, and that's inserting a needle into the belly to remove fluid. This concludes my assessment on the inspection of the abdomen. Thank you.